Depression is a state of a persistent feeling of sadness and aversion to activity. It is a major issue in the current world. In the United States, close to 10% of adults struggle with depression. Depression has an impact on the person, both on the outside and inside. These include a persistent feelings of sadness, anxious, an empty mood, and a feeling of hopelessness that lasts nearly every day for weeks on end. Many people have confused the difference between having depression than just feeling depressed. When one faced with a difficulty or a loss, we may lose our sleep, appetite, and enjoyment in socializing. This kind of behavior is normal, as such it will go away in a couple of days. But if this behavior goes on for more than 2 weeks, then it can be assumed as a clinical depression. There are many causes that can lead to depression. However, today we're just going to explore 3 major causes, which is environment, drug and alcohol, and self-unappreciation. First of all, the environment of a person is one of the big factors that determines how one would feel in her or his daily life. Major life events such as an accident, losing a job, retiring, being abused, or going through the rigorous process of a divorce could be the example of an environment changes in a person's life. The more stresses that occur over time, the greater the likelihood of getting depressed. Rates of depression has been rising among the young, who increasingly report due to the loneliness of having no friends, a school bullying, or the struggle of school works. Next, drug and alcohol. Many people with depression also have drug and alcohol problems. This factor unconsciously could be connected to our first factor, which is the environment. Most people that go through their hardships in life has turned to drugs and alcohols as their company. However, according to most professionals and psychiatrists, the ability of a certain drug to cause depression is of a clinical relevance only because there is no specific drug for it to be accurately defined as evidence of a cause that leads to depressive disorders. This also refers to alcohol. Nevertheless, for a number of drugs and alcohol, the evidence is suggestive, although not conclusively of the cause of depression. Moving on to the last factor, which is self-unappreciation. Those that do not appreciate their whole existence don't hold high standards for themselves. They are just perpetual self-critics, always judging themselves harshly. Worthlessness is a major emotion that makes oneself gives up in trying to appreciate their life. It is a feeling that may cause an individual to feel as if there are no benefits or purposes in whatever they do. It can also have a significant negative effects on emotional health. The longer one experiences feeling of self-unappreciation, the more difficult it may be for them to overcome these feelings without help. It may develop into a prolonged state of negative mood, and they can also affect physical health. Now, depression can affect us in so many aspects as it is a serious life-threatening. Most of people that deal with depression will encounter a loss of interest or pleasure in any activities. They hardly go outside of their house, and the hardest work that they've done in a day are probably just to wake up from their bed. Besides, as depression affects us physically, it causes a serotonin, which is a chemical in our brain, to decrease. This could lead to a foggy memory or a difficulty to memorize things. Other than that, one may even try to attempt suicide. In fact, most people had already done it. According to a Suicide Awareness Voices of Education, SAVE, nearly 800 people die by suicide in the world each year, which is roughly 1 death every 40 seconds. And according to a study conducted by researchers at Seoul National University, found that depressive disorders are one of the risk factors for lifetime suicide attempt. Hence, scientists and psychiatrists have been searching for a solution to prevent depression. One of those solutions is to exercise. Start to practice on healthy daily life as it gives you more energy. There are several sports that you can try to figure out what works best for you. For example, jogging, playing badminton, cycling, etc. Regular exercise can positively impact serotonin levels in your brain. It will boost your memories, mood, and sense of well-being. It can also help improve your appetite and sleep cycles, which are often negatively affected by depression. Other than that, have a therapy. A therapy is the attempted remediation of a depression, usually following a medical diagnosis. Therapy comes in many ways. One of it is a talking therapy, where you find someone to express your feelings. Therapy helps you improve relationships with family and friends. Lastly, get enough rest. The best way to get enough rest is to have a good sleep. For optimal physical and mental health, most people need about 6 to 9 hours of sleep per day at regular times. But people with depression have difficulties with sleep. Getting a good night's sleep can be an important part of your plan to manage depression. When you're well rested, you'll not only have more energy, but you may also have a more upbeat view on life and a better focus. In a nutshell, depression is a serious disease that requires professional treatment, and it cannot be treated as an unimportant thing. Factors such as environment, drug and alcohol, and self-unappreciation can lead to several impacts, such as a loss of interest or pleasure in any activities, and even attempt suicide. Some of the ways to prevent depression is to exercise regularly, get a therapy, or get enough rest. In my personal opinion, depressive disorders really could be a bigger problem if you kept it a secret and think it's not a big deal. Population of people having a depression is getting increased over the year, and I really hope everyone make an effort to change that. This includes the government, the person who's facing the problem themselves, and even us. Always remember to stay positive and be confident in whatever you do. Love yourself as you are loved by everyone. That's it from me. Thank you.